Antibiotic-associated diarrhea describes frequent, watery bowel movements, diarrhea, that occur in response to medications used to treat bacterial infections, antibiotics. Most often, antibiotic-associated diarrhea is mild and clears up shortly after you stop taking the antibiotic. But in some cases, antibiotic-associated diarrhea leads to colitis, an inflammation of your colon, or a more serious form of colitis called pseudomembranous colitis. Both can cause abdominal pain, fever, and bloody diarrhea. Mild antibiotic-associated diarrhea may not require treatment. More serious antibiotic-associated diarrhea may require stopping or switching antibiotic medications. Symptoms: antibiotic-associated diarrhea can cause signs and symptoms that range from mild to severe. Common signs and symptoms: for most people, antibiotic-associated diarrhea causes mild signs and symptoms, such as loose stools, more frequent bowel movements. Antibiotic-associated diarrhea is likely to begin about a week after you start the antibiotic therapy. Sometimes, however, diarrhea and other symptoms may not appear for days or even weeks after you've finished antibiotic treatment. More serious signs and symptoms: some people experience a more serious form of antibiotic-associated diarrhea when the overgrowth of harmful bacteria is severe. You may have signs and symptoms of colitis or pseudomembranous colitis, such as frequent watery diarrhea, abdominal pain and cramping, fever, mucus in your stool, bloody stools, nausea, loss of appetite. Causes: antibiotic-associated diarrhea occurs when antibacterial medications, antibiotics, upset the balance of good and bad bacteria in your gastrointestinal tract. The antibiotics most likely to cause diarrhea. Nearly all antibiotics can cause antibiotic-associated diarrhea. Colitis or pseudomembranous colitis. The antibiotics most commonly linked to antibiotic-associated diarrhea include cephalosporins such as cefixime, Suprax, and cefpodoxime, clindamycin, Cleocin, penicillins such as amoxicillin, Amoxil, Laratid others, and ampicillin, fluoroquinolones such as ciprofloxacin, Cipro, and levofloxacin, Levaquin. How antibiotics cause diarrhea. Your digestive tract is a complex ecosystem that's home to millions of microorganisms, intestinal flora, including hundreds of species of bacteria. Many of these